Maggie, can you hear me?
Yes, now I can.
Okay, great. Thank you so much for talking with me. I've been so excited about you joining Mental Health America. Um,
Thank you. I'm excited to be here talking about it.
so just to give our viewers a little behind the scenes information, Mental Health America Spartanburg did a search for an executive director during a pandemic. And it
Right,
took some doing to find Maggie Gainey, who officially joined in January, right?
that's correct. Yes.
Okay. And I'm gonna pull up your bio that's posted on our website, mhaspartanburg.org. Maggie has a PhD in clinical psychology from Fuller Theological Seminary in Pasadena, California. She is a psychologist and faculty member part-time with Spartanburg Regional Healthcare System Family Medicine Residency Program. Previously, she was in private practice and she worked in behavioral health regional psychiatry at Spartanburg Regional Healthcare System, as well as behavioral health at Regenesis Healthcare in Gaffney. She is a trained mental health first aid instructor and has extensive experience with trainings in Spartanburg County through SC Thrive. Does all of that sound pretty up to date?
That is very up to date. Yes. And I think probably the most relevant, experience that goes along with this particular role that I'm in. So,
Okay.
yeah.
So, what attracted you to Mental Health America and the executive director position?
Well, as you can imagine, being a therapist for about 17 years now, I've definitely seen in our community um, the unfortunate difficulties that patients have dealt with in terms of trying to seek services or get services or even being willing to identify themselves for needs, needing services because of stigma around mental illness. And so it's always, I guess, my passion, personal passion and professional too, has aligned with Mental Health America and their own mission. And so when I saw the position open, I thought maybe this is my way to get involved with this organization, because I've been watching it grow over the years and really was excited to be a part of something, a movement basically, to try to increase awareness and decrease stigma. So
Okay. And of course, the executive director position will benefit from your clinical experience and expertise, but there's also that community engagement aspect,
yes,
uh,
yes.
as well as the leadership component. So can you tell me a little bit about what you see coming ahead for the year for you, for Mental Health America Spartanburg, what you're most looking forward to?
I'm really excited. There's a lot of fun, opportunities to engage our community about these particular topics. One thing that I hope to do with my contacts, that community engagement that you talked about, is to get some collaboration going with our physicians through Spartanburg Regional Health System. We have a great group of teaching faculty here at the hospital who are very encouraging of behavioral health services being part of the overall wellness and taking care of their patients. And so I really like our community to hear more from them. And I think being in this role, I'm hoping to be able to, pull some folks over and encourage them to share their own experiences, both personally and professionally, and in terms of, awareness about these particular concerns, mental health concerns. one of the things that's I feel really excited about at the moment is that we've been talking with an artist in town named Bailey, and Bailey had his own personal process, his own recovery from a time where he had about a year where he wasn't able to produce any art, and realized that he probably needed to talk to somebody, and through his therapy has created these incredible paintings illustrating his own process. But not only that, he has decided to put together an exhibit that's based on 6 different people that he has been able to interview about their own experience with mental illness, and he's created a piece of artwork for each of them. So we're hoping for May to be, kick off Mental Health Month by collaborating with him, and I've been talking to some of our physicians who like to do artwork on the side as stress relievers, and I think that trying to pull those together is going to be really engaging for our community. I think it's going to be important for not only to get information out, but I think people will actually find it enjoyable and interesting, and want to learn more because of it. So
And having more people share their own personal experiences really goes a long way in removing the stigma
absolutely.
associated. So that's exciting. That's exciting. So when you think about what this position is bringing to you from your personal life standpoint, I take it you've got people who are excited for you and
Yes.
maybe now connected to Mental Health America Spartanburg or to your vision.
Yes. Yes. I mean, I think not only people who I work with, because I think they're excited, they're starting to see such a value in um, not only utilizing the information that we have in behavioral health to help their patients here at the hospital, but they're also seeing the need for reducing stigma throughout the community. And I think they're excited for me in that regard, because they know I've already been quite an advocate for that in my own, personal and professional life. I mean, I personally off and on have struggled with some depression and anxiety. I have had many family members who also have, and um, I've been fortunate because I actually am in the field. So I've been fortunate to not only have had some support and encouragement from other mental health professionals to seek treatment at times, but I also have um, I've seen that it's not easy to basically come out to say, this is something I'm really struggling with and I need help with it. And so I really want to encourage, I want people to be able to talk about it like we talk about diabetes and heart disease.
Mhm.
It really needs to be that matter of fact, in my opinion. So
Mhm. Oh, yeah, absolutely. We all have physical health. There are those of us that watch our diets, some more, some less. We, exercise, some more, some less, but we all have physical health. And so it's not uncommon to say, I'm new to town, who's your doctor? But we don't
right.
treat mental health that way, you know?
No,
Uh,
unfortunately, it's not.
and it also seems like the one of the early results of the pandemic has been on increased mental health needs. And I still see that. It started certainly last spring, but I still see very, very elevated needs in the community. So normalizing this is what we do when we feel this way. Um, okay.
And it's affecting health professionals at all levels too, because our health professionals are in many cases having to step up and take care of more people right now. And so I guess that's a part of my vision too, is to really encourage our health professionals to share their real experiences, because they are seen as an authority on overall wellness. And if they can come out and explain, that this is a struggle for all of us at times, and we need to find support for each other, and be able to recognize the signs and symptoms, when we need additional help, additional services. That's my real hope, is that, like you said, by sharing, real people's experiences, that we'll actually be able to get more awareness out there, but also maybe even feel like we're a little bit more on the same page as a community, in terms of trying to take care of people in all their different levels of health and wellness. So,
Hmm. Right. And I love that community awareness of different needs, different services, and increasing access.
yeah.
So I'm curious, Maggie, do you mind sharing why you went into the field to begin with?
No, I don't feel. My Well, so my father is a minister and my mother is a teacher, special ed teacher. So I watched them be, to a certain degree, caregivers, in their roles. They were in service, health service professionals, so to speak. And I wanted to do something along those lines. I watched them benefit from the rewards of those careers, but I also watched them be taxed by them at the same time. And so I really wasn't sure how that was going to go, what that was going to look like, but it definitely gave me a strong interest in understanding the psychological aspects of ourselves, and wanting to understand that more, just a real yearning for that. I was actually pre-med when I was in
Hmm.
college, and I majored in chemistry at first, but then I I took my first psychology class, which happened to be a psychology of women class, and
Hmm.
was just enthralled. And I went to my professor and said, I want to switch majors. I think this is much more of a fit for me.
Hmm.
And she agreed. She was, really encouraging of that. And so I decided that if I was going to go for the doctorate, for the MD, then I needed to do the same thing in psychology, if that's the field that I really wanted to be in. So and it has proven to be a good fit for me. So it really has.
Well, wonderful. And now you've wound up in this position with Mental Health America and in Spartanburg, which in the years that I've been involved in the clinical aspects of Spartanburg, there's lots of supportive organizations. And I know Mental Health America Spartanburg has partnerships, formal and informal, with a number of them. So
Mhm.
it's exciting to bring all that together. Is there anything else that you might want to tell people or invite people to, or
Well, we do have several educational opportunities that are already on our schedule and on our website, so that people can not only learn about those particular topics, but when they're being held, and can go ahead and register for them. One is our Lunch and Learn series that we have every other month, and our next one will be with Dr. Jim Rentz,
Mhm,
who is going to be talking specifically about trauma related to being involved in war in particular,
mhm,
but he has both personal and professional experience with trauma, and um, has some really good stories to share with us and good information. So I'm really excited about that one. And that's on March 11th. Then we
mhm,
have in the fall, we will be having the Mental Health Symposium. We're still not 100% sure if it's going to be live or we're going to be doing it virtually like you and I are doing right now. But hopefully we'll get some more of that information soon. Um, Mental Health Month is sort of the next big kickoff thing, or event, and we're still planning some of those. So stay tuned, because I think we're going to have some fun and engaging events to help get people familiar with this material, familiar with the concepts around mental health, and how to increase wellness in
mhm,
general.
mhm,
And like I mentioned before, I think you're going to see more collaboration with different organizations throughout the year, with the art work in particular. That'll be coming up soon. The last thing, and probably maybe even the most important, we will be launching in April a resource section on our website, and we're very excited about this. As you know, Susan, you really have spearheaded this, the video part of this section, which is going to really allow us to highlight different therapists, different practices, different services in the community that people may or may not know much about. And that's really the idea, is to put that information out there. It will also have some educational articles in that section, and it will be searchable. So we hope for it to be pretty comprehensive and searchable, and also have referral information as well for different community resources. So we're really excited about that. And I believe that if you go on our Facebook page right now, you can see a little tease about the first video that you've done, Susan, with Dr. Kelly Kennedy at Modern Wellness Family Counseling. So that could kind of give folks an idea of what is to come in the future. So,
well, wonderful. And it's in line. What Mental Health America Spartanburg is doing is in line with what other clinicians are doing. As needs have changed, we're working to meet those needs differently. I love the idea of helping put information into the hands of people and to make it so accessible. So thank you so much for your time, Maggie. I really enjoyed talking with you and learning more about you. And I'm excited for your leadership at Mental Health America Spartanburg.
Thank you so much. Looking forward to working with you more.
Absolutely. Take care.
Okay, bye-bye.